Modified Centor score for streptococcal pharyngitis. Pharyngitis is an inflammation of the pharynx, the area in the back of the throat. This inflammation causes the symptoms of sore throat. Although most infectious causes of sore throat are due to viruses, about 5 to 10% of pharyngitis cases result from a bacterial infection. Strep throat describes this throat infection since the bacteria most often responsible for bacterial pharyngitis are a strain of Streptococcus bacteria. Strep throat is more common in children aged 3 to 15 years, but it can occur at any age. Strep throat spreads easily and quickly from person to person in close contact settings such as school, household, or daycare centers. The modified Centor score is a clinical decision rule used to assess the likelihood of streptococcal pharyngitis or strep throat in patients with sore throat. Estimates probability that pharyngitis is streptococcal and suggests a management course. They use only in patients with recent onset or less than 3 days acute pharyngitis. This helps the clinician to reduce unnecessary antibiotic use by identifying patients who are unlikely to have strep throat and therefore don't need antibiotics, which can contribute to antibiotic resistance. It also improves diagnostic accuracy by helping to differentiate strep throat from other causes of sore throat. It guides treatment decisions by suggesting when further testing and/or antibiotic treatment is appropriate. The modified Centor criteria help clinicians decide whether to test for strep throat and subsequently whether to treat with antibiotics. By identifying patients with a low risk of strep throat, it helps to avoid unnecessary antibiotic prescriptions, which can contribute to antibiotic resistance. The key difference from original Centor score from that of modified Centor criteria, the original Centor criteria developed in 1981 did not include age as a factor, but the modified one, or the Mrs. modification developed in 1998, added age as a factor, which has been shown to improve the accuracy of the score in predicting group A streptococcal pharyngitis. The 5 criteria are fever, cervical lymphadenopathy, tonsillar swelling or exudate, cough, and age. If there is fever or temperature greater than 30 degrees Celsius at axillary measurement, we give 1. If it's not there, we give 0. If there is enlarged and tender anterior cervical lymph nodes, we give 1. If there is no lymphadenopathy, we give 0. Tonsillar swelling or exudate gives 1. Absence of cough gives 1. Presence of cough gives 0. Age between 3 to 14, 1. 15 to 44, 0. Greater than 45, -1. So, this is a modified Centor criteria or Mrs. criteria. This modified Centor score uses age as one risk factor. Let us see the interpretations. Based on the result, we classify as low risk, moderate risk, and high risk. Low risk is a score of 0 or 1, which suggests a low risk of strep throat. In this case, further testing, like rapid strep test or throat culture, is generally not recommended. For moderate risk, or a score of 2 indicates moderate risk. Testing with a rapid strep test is often recommended. High risk or score of 3 or 4 indicates high risk of strep throat, and testing with rapid strep test or culture is recommended. If the rapid test is negative, a throat culture should be performed. So this is a summary of a modified Centor score. For score 2 to 5, rapid strep test is needed. If it is positive, we will treat it. If it is negative, the child is school-aged and we should have to send throat culture and treat based on the result. Thank you for watching.